The PERSEUS trial is a very important prospective randomized trial in transplant-eligible newly diagnosed patients with multiple myeloma. And there are two treatment arms. The standard arm consists of the combination of Bortezomib, Lenalidomide, and Dexamethasone as an induction, followed by high-dose therapy, then consolidation. And the investigational arm is the same, but with the addition of Daratumumab. Subsequently, the patients also get to be randomized to Lenalidomide or Daratumumab with Lenalidomide. So the primary endpoint of the study is progression-free survival, and this was reached. So there was a significant improvement in progression-free survival in favor of the quadruplet, which include Lenalidomide, Bortezomib, and Daratumumab. So I believe this is a practice-changing trial that will lead to the formal approval of this quadruplet in Europe as well.